Forget COVID and all its political baggage. Pretend our hospitals are full of snakebite victims. If you need a bed and you can't get one, that's a crisis. And Colorado's healthcare system has never been this stressed during the pandemic. Who else is concerned that no one can explain why Colorado is in such particularly rough shape with COVID right now? A tiny grassroots campaign defeats Denver's power brokers' plan to build a new arena.
I don't think in any way it's a David versus Goliath,
said Goliath the morning after getting whipped by David. And the warning about aggressive elk that aggressive elk don't want you to see. Next. If you or someone that you would like to stay alive needs a hospital bed, it doesn't matter if the capacity crisis is caused by COVID or something else. It's a real issue. Colorado's hospitals say that 90% of ICU and critical care beds are full, many with non-COVID patients. And the hospitals report to us that the system has never been stretched this thin at any time during the pandemic. The Colorado Hospital Association has activated what it calls its Tier 3 system for transfers. So there's a single center that manages patient caseloads across the state, able to help move patients here and there to keep hospitals from overflowing. We've gone beyond the point where they're just moving some recovering COVID patients from crowded urban hospitals out to rural areas. At this point, patients with and without COVID can be transferred without their consent anywhere in the state.
So it could be a COVID patient, it could be someone who's recovering from a heart attack or a stroke. And really, the hospitals will make that determination based on their resources and their needs and the level of care available. But it really could be any type of patient that may need to be transferred.
Another day, another record for COVID hospitalizations in Colorado, as primarily unvaccinated patients are too sick to be at home. 1,280 of them in Colorado's hospitals. That's a jump up of 26 patients in a day and up almost 90 patients from this time last week. Capacity concerns last year led the state government to set up field hospitals that never got used. We've heard from a few Next viewers, including JR in Wheat Ridge just a few minutes ago, who asked if those facilities might be brought back online. Short answer from the state today, not now. The state told us that it has supplies to set up a 200-bed field hospital, but they don't have a lease anymore at the Colorado Convention Center. That was a $21 million field hospital project that never saw a single patient. The ranch in Loveland was also turned into a field hospital in 2020. That, too, never saw a patient. The state does not currently have a lease there either. So Colorado's current COVID wave is not reflected across America. We are one of the 5 hardest hit states right now. And Colorado's public health leaders say they don't really know why. That would appear to be concerning. Here's Steve Staker.
Our volumes are up, obviously. When you look at the patients that have COVID that are hospitalized, they're primarily unvaccinated.
That's the frustrating thing for doctors and medical workers. Most of the growing number of the hospitalized with COVID in Colorado haven't gotten the shot. But it still doesn't explain why Colorado's seeing a surge while other states aren't.
Certainly there's a regionality. There's no question about that. If you look at our rates and compare them to Texas and Florida a month ago, we were really far apart. And now if you look at them right now, we are much higher than them.
As our numbers here started to rise again while so many other states waned, we've consistently asked the state's public health leaders if they can explain why. And they've told us they don't exactly know.
It's not just one thing that's probably driving this. And I think they are hoping to find a smoking gun, and it's probably not that simple.
Infectious disease expert Dr. Michelle Barron with UC Health says we shouldn't be surprised that state health leaders can't pinpoint a precise reason why. Remember, this is a novel or new virus, even 20 months down the line.
These things take years and years and years, and we still will probably not know everything even after that. HIV is a great example. Like, how long has HIV been around? 20, 30, 40 years, maybe longer now, if I do the math. And we still don't have all the answers to that. And that's a common virus that we've seen.
Dr. Barron says there could be a level of seasonality to the virus, too. Think about last November when things got bad. But she says that the data also disputes that because we've seen spikes in warm and cold weather. Shows that it likes the cold, but it also seems to like the warm. It could take years of study to try to figure out how this virus works. and what leads to wider spread, Kyle. But the thing you have to remember is we've done a lot of things with this virus very quickly. We've kind of operated at warp speed, and I think that that's how our brains trigger now, is that we think that we should know everything about this because things have moved so quickly.
Yeah, we forget the novelty of the novel coronavirus, that, you know, just because somebody is a medical professional or they're a research scientist, they can't just flip to that page in the book and say, well, here's what we've learned over the last 50 years.
Absolutely. And I think we've gotten kind of a gift here. We have a vaccine already. A lot of different developments that we've been able to figure out how the disease spreads a little bit easier. But it's going to take years and years of study. In fact, they'll probably be talking about this in college classrooms and universities for a long time.
It's disconcerting when we don't have the answers about why the virus is doing what it's doing. And then what happens is a lot of times people's political beliefs about what's working or what's not working gets supplanted for the best available science, even if it isn't complete. All right. Thank you, Steve. Denver's STAR program, dispatching behavioral health pros instead of police to some 911 calls, is now looking to expand its reach and also change how it's dispatched, moving beyond 911. Which some communities hesitate to call for fear they're going to get sent a police officer when what they really need is behavioral health support. Denver's STAR pilot program has responded to 1,100 incidents in 2 years, and according to the city, only once did a call escalate into something that needed a uniformed officer. The STAR program is now being replicated in other cities around Colorado. There are 2 vans in Denver at this point. They often respond to calls involving people living on the streets, welfare checks, overdose reports, trespassing calls. The idea is that people in those situations often need mental health services, not handcuffs in a jail cell. The team currently uses the 911 call system to respond to places where they are needed. That could change.
There are maybe a number of communities that are initially reticent to make a call to 911 because a stigma is a reality in many of the communities in Denver. And so we're continuing to push even on that front to look at ways that we can engage STAR in the future without having to go through 911.
Organizers are hoping to expand Denver's program from the 2 teams responding to calls citywide to 6 teams by the end of the year. That means adding more response vans as well. And they could expand to as many as 10 teams if the number of calls warrant. We should mention, last summer, one of your very first Word of Thanks microgiving campaigns helped purchase supplies that were not covered by the pilot program. Overdose deaths in Colorado have spiked since the start of the pandemic. Recovery advocates are strained right now, trying to connect with the right people at just that right moment and then stay connected to save lives. We can help with that. Your Word of Thanks microgiving campaign this week supports Advocates for Recovery, a nonprofit that helps Coloradans navigate recovery from drugs and alcohol. Advocates for Recovery works on the peer model. So people in recovery are guided, coached, and counseled by other Coloradans who are in long-term recovery themselves. They speak from shared experience. Advocates for Recovery is looking for funding to continue and expand an innovative pilot program of theirs that's showing real promise. They've put a peer counselor right inside an emergency room in the metro area. So when somebody comes in with an addiction-related issue, once they're medically stable, an Advocates for Recovery peer counselor is able to walk in and offer options, offer some off-ramps from addiction. And together we can help Advocates for Recovery take its peer recovery counselor in the ER model and expand it to more places. Scan the QR code on your screen or text the word THANKS to 303-871-1491 and I'll send you that link to donate. As always, I'll match the first 50 donations of $5. And we see the news of overdose deaths increasing. I think many of us have witnessed the destructive power of addiction in people we know. Advocates for Recovery is meeting people at one of those low points and offering the kind of understanding and guidance that comes from life experience to help them find a way out of addiction. Thank you for helping them expand that work. Money doesn't buy happiness, or buy the mayor his new arena. How a tiny campaign faced off against the most powerful interests in town and won.
What they were selling was a dream of the National Western, not a dream or the needs of my community.
And students go from CSU to Scotland to tell world leaders a little something. They'd like to be able to breathe the air when they're as old as the people making the decisions. Next. In 1972, Denver Mayor Bill McNichols asked voters to approve an arena. They said yes. That was McNichols Arena. In 2021, Denver Mayor Michael Hancock asked voters to approve an arena. They said no. That was last night. Politics guy Marshall Zellinger is out at the National Western Complex where that arena will not be built. And Marshall, powerful interest on this ran into a grassroots wall.
Kyle, based on campaign contributions alone, 2E should have breezed to victory. The yes side had enough money for that TV political ad of that sad, downtrodden arena seat somewhere in there from 1909. The no side didn't have enough money for an ad. It had enough money for a website and some printing.
We are currently in Elyria along with Gloveville and Swansea.
Alfonso Espino
Well, a yes wouldn't have solved it either.
is bullish about his stance on ballot issue 2E, the failed proposal to build a new arena and convert this 1909 stadium building into a public market at the National Western Complex just down the street from his home.
At the end of the day, what they were selling was a dream of the National Western, not a dream or the needs of my community and the people of Denver as a whole.
What the National Western wants is good for the whole city and is particularly good for the residents of Gloveville, Elyria, and Swansea.
Pat Grant led the Yes on 2E campaign called the Friends of the National Western Stock Show.
We did not have time to fully campaign and explain that proposal.
But they did have the money. About $900,000 contributed in support of 2E, which lost by almost 17 points.
Yeah, it says that money can't buy votes.
Sarah Lake led the campaign against 2E.
We raised $3,200 in total as of our final count.
$3,200 to $900,000. Basically, for every $1 no had, yes had close to $300.
I don't think in any way it's a David versus Goliath. I know it's tempting to you people, the press, to say that. I get it.
Their spending efforts say that they tried their best, but on substance, you can't convince people when there's nothing there tangibly that most people can actually benefit from.
Lost by almost 17 points, and the other bond issues won by no fewer than 23 points. The failure of 2E, however, is not the end of a 10,000-seat arena and a public market taking over that 1909 building. A spokesman for Mayor Michael Hancock tells me there's a framework agreement with this National Western Complex that an arena will be built and that will become a public market. And in the words of the spokesman, they have to get creative with the funding. Just not through the spawn process, Kyle.
Oh, that's interesting. So after all that, still might not be dead yet. Interesting stuff. One of the key things we were watching last night on election night. Thank you, Marshall, and all the rest of you people. Be careful not to read too much into off-year election results, says the guy about to read into off-year election results. Let's just look at what happened, say, rather than projecting onto what's going to happen in 2022 or beyond. It's clear after last night that Colorado's blue wave in recent elections does have its limits. Conservative Douglas County wanted a conservative school board. Aurora, which has never had a Democrat-led city council, was definitely not interested in a Democratic majority featuring a third Democratic socialist, no less. She got wins for Republicans in areas of Colorado where Republicans win. Denver voters certainly seem to signal a departure from the Hancock era of homeless sweeps and friendliness to developers and their projects. And what stands out most from election night, in my view, is just how carefully Coloradans approached spending issues. Denver's bond projects usually catch more green lights than Matthew McConaughey, but voters sorted out the mayor's arena project and voted that down while approving the rest. And statewide, conservative groups that can usually bank on Colorado's past willingness to cut taxes and constrain spending, they were rejected twice. So what's all that mean for 2022? Beats me. Election night 2021 was pretty interesting all by itself. Young Coloradans would like a word about the world we're leaving them.
Our problems are big, but we're not helpless. And there are things we can do.
From wildfires to air quality, they are paying attention to adults' actions, and they're not impressed. Our state's elk are nothing if not predictable, so says the sign. Next. Graham's in the weeds again. All sorts of experts are assembled for the World Climate Conference in Glasgow, Scotland, and a group of Coloradans is in that crowd. CSU students offering their expertise on optimism. Coloradans are living and breathing the consequences of climate change-fueled wildfires these days. You had the Cameron Peak fire west of CSU campus last year. Days of bad air quality because of the smoke that came in from out of state. So enter Katie Barker, an ecosystem science and sustainability student at CSU. She told this global crowd in Scotland about the student activism going on in Fort Collins, where they're pushing for renewable energy, adding composting bins, creating gardens to make sure that pollinators like bees and butterflies can survive. It's the stuff that gives her hope.
It's been really cool to see how students can be agents of change and how that can translate into the community, because hopefully the community is taking note and saying, hey, together we can do more and we can do something.
Optimism paired with action is the prescription the CSU students offered world leaders in Glasgow, and the message that they also push on their Climate Solutions podcast.
How great was it to see clear skies, sunshine today, and warmer temperatures, seasonal highs in the mid to upper 50s. Guess what? We're going to go 10 degrees warmer tomorrow. High pressure is building in as our latest storm tracks off to the east. High clouds coming in from a Pacific storm, but that storm is actually going to go north of us. Tonight, calm, quiet, low 32. Tomorrow, sunshine and 67. We get you into the 70s for Friday and for the weekend. But don't forget, this is the weekend the daylight saving time comes to an end. Time to set those clocks back 1 hour when you go to bed on Saturday night.
It's a sign, and it's evidence. Warning, aggressive elk present. Though it's tough to read the sign's advice from Colorado Parks and Wildlife for avoiding said aggressive elk, because a good chunk of the sign has been taken out by some aggressive mystery animal. Don't know. No suspects. Thanks to Anita for a good spot on that sign. Saving a life can be about the right person being in the right place at the right time. Our Word of Thanks campaign tonight will put an addiction recovery counselor, a fellow Coloradan who's in recovery, right in the emergency room as people decide whether they're going to use again or seek help. That and your feedback next. Advocates for Recovery is a nonprofit group of Coloradans who are in addiction recovery themselves, who counsel and guide other Coloradans in the same spot. And one thing they noticed over the years is that when somebody goes into the ER due to a serious issue with drugs or alcohol, the hospital staff, often overworked, does a great job of medically stabilizing them, but it's not their job to guide them into the next step, recovery. So Advocates for Recovery has a pilot program putting a peer counselor in the ER, so somebody is there who knows that addiction and recovery journey and can talk about real options. She's currently working with 60 people a week at one ER. You scan the QR code on your screen or text the word thanks to 303-871-1491 to get a link to donate as we help Advocates for Recovery expand that ER program. We can help put a literal lifesaver in the very room where they are needed most. Take it from the people who know. This can make a difference as Colorado's overdose deaths spike. Danny Barton writes in to say, fear sells, but you guys can't be getting the attention that you used to. When are you going to slow down on the COVID stuff? Danny, go back to what I said at the very beginning of tonight's program. Pretend that COVID does not exist. That's actually been some people's strategy. Pretend that it's something else that's filling Colorado's hospitals right now, causing involuntary transfers around the state. If you go in with a heart attack, I want that bed to be there for you. So we should keep talking about the situation.